So correction is considered to avoid the cardiovascular effects of severe metabolic acidosis. So this is the reason why we don't like a pH below 7.2. It's not clear cut whether it's 7.1 or 7.2, and each baby's threshold may be different. So we have to balance it. So it's not a magic number that the moment it goes below 7.2, we have to correct it. So we have to look at the clinical picture of the baby. If the baby is hemodynamically compromised, if the baby is on inotropes, you may have a threshold of 7.2. But if the baby is relatively stable, you can wait till 7.1 even. So between 7.1 and 7.2 is where the cardiovascular function is pH dependent, and below 7.1, of course, it will definitely fall. So you can justify giving bicarbonate if the other measures don't work or the baby is showing features of not coping. And as I mentioned, altered sensorium can be associated with the drop in pH, and especially if you give the bicarbonate without appropriate respiratory support, intracellular acidosis may worsen, and this also affects the sensorium. And one of the important factors to remember is that a compensatory mechanism for acidosis is a shift in the oxygen hemoglobin dissociation curve to the right, which means the oxygen is released more easily to the tissues to reduce the tissue hypoxia. And when you give bicarbonate and you bring the pH up, you are going to lose this benefit. So keep that in mind, that again respiratory support and oxygenation is important before you jump to correct the metabolic acidosis, especially if you are using bicarbonate.